वेलकम टू माय चैनल ओ यस लिमिटलेस। आज है संडे एंड मैं आ गई हूँ फिर से एक नए ब्लॉग के साथ और आज पहुँच गए हैं सेंट जॉन सेंट बेनेडिक्ट्स कॉलेज। यहाँ पे आज स्पेशली ये लोग हेल्थ रिलेटेड कोर्सेज जो अवेलेबल हैं, जो चेकअप वगैरह करवाना है तो हॉस्पिटल्स कहाँ कहाँ उनको जाना चाहिए, कौन से डॉक्टर्स के पास जाना चाहिए, कौन से डॉक्टर स्पेशलाइज्ड हैं पर्टिकुलर उस फील्ड में, प्लस जो लोग इसी सेम पर्टिकुलर फील्ड में जॉब्स देख रहे हैं उन लोगों के लिए आज ये ऑर्गेनाइज किया गया है। सब सेक्टर्स का एक एक आध स्टॉल अंदर बनाया गया है। अभी हम लोग अंदर जाएंगे और सब लोगों से बातचीत करेंगे कि वो लोग क्या क्या ऑफर कर रहे हैं। और ये वाला जो इवेंट है गवर्नमेंट ऑफ माल्टा की तरफ से ऑर्गेनाइज किया गया है। आई होपफुली आपको मेरे इस वीडियो से काफ़ी इन्फॉर्मेशन आज आप लोगों को मिलेगा। तो चलिए दोस्तों लेट्स गो। आप सभी को एक ज़रूरी बात बताना चाहूँगी। आज मैं ये वीडियो बनाने का मेन ऑब्जेक्टिव ये भी है कि जैसे कि आपने मेरे पिछले वीडियोस में सुना ही होगा कैसे दूसरे जॉब्स इफेक्ट हुए हैं ड्यू टू न्यू रूल्स एंड रेगुलेशंस, लेकिन मेडिकल फील्ड ही एकमात्र ऐसा सेक्टर है जहाँ पे माल्टा भी पूरा सपोर्ट कर रहा है कि फॉरेन से लोग आए और इस फील्ड में ज़्यादा से ज़्यादा जॉब अपॉर्चुनिटीज एक्वायर करें। मैं भी यही उम्मीद करती हूँ कि आप लोगों को ये वीडियो आज हेल्प करे आपके आने वाले प्रोसेस के लिए। So this is from the Health Promotion and Disease Prevention Directorate and I have my friend here. She is going to tell us about the things which they are offering to us.
We are a team of different healthcare professionals, nutritionists, psychologists, nurses and doctors. Basically our work focuses on awareness, education and information to the general public, and we provide all leaflets, for example, provide education in schools, speeches to the general public.
It was nice interacting with you. I hope from our channel if someone is interested and someone is willing to get some help from this place, they can definitely come and we will share the information on our description so you guys can reach them out. And thank you so much. This section is for the pharmacy people, those who are looking for careers. We can go through these details if you can see for the people who are looking for jobs in pharmacy sector. ये वाले स्टॉल पे हमें जो बताने वाले हैं कि how healthy lungs and unhealthy lungs function and what are its causes.
This would be normal bronchus, so a healthy bronchus, someone who doesn't smoke, and the airway is clear, and the person will be able to breathe in and out normally. However, with the effects of, for example, smoking, someone will get chronic bronchitis, so there will be this build-up in the middle of the bronchus, and the person will have difficulty breathing in and out. So they would always be out of breath, their body would not be getting the oxygen that they need, so it would be much more difficult for them to have.
If we do not smoke, then yes, definitely we will have healthy lungs. Thank you so much for the introduction. We are also getting some goodies from here. This machine is to read your palms. This is for psychiatric mental health nurses. अगर कोई इस फील्ड में अप्लाई करना चाह रहे हैं तो वो यहाँ पे भी आ सकते हैं इस सेक्शन में।
So we're here representing occupational therapy. Our role, so from when they are babies up till when they are in their adulthood, and their role is to help as much as possible people be independent and also live a good quality of life. So if I have a person that sustained an injury to a fall, for example, or they happen to have a stroke, or they were working in a construction site and they suffered from a spinal cord injury, obviously your independence and your participation in everyday life is affected. So I'm saying from when you first go into bed, at night, waking up in the morning, having to use the toilet. So if, for example, I'm working with the physiotherapist, because we also work with a lot of other professionals, the physiotherapist will help the person gain their mobility. How can I, as an occupational therapist, help that person function in everyday life? Some things that you acquire throughout life, I mean, even if you work with the elderly, that certain things would not remain as easy and straightforward. So if, for example, through age, I acquired arthritis or I have limited range of motion in my hands, I can use equipment such as this utensil. As you can see in the hand, from where you grip, it's thick, so I can apply less pressure and so I wouldn't have to turn my wrist around to feed myself. Since it is curved, I can just poke the food and then eventually feed myself without putting a strain on my wrist. So we use a lot of equipment, as you can see, and as well we also go into the environment, making environmental modification.
Thank you so much for the introduction.
And with this we here come to decontamination technicians counter. With all the sectors we are covering today, I will be sharing the careers link from where you can apply for jobs, for medical related courses as well. So don't forget to check the description box below.
My name is Patricia Brinkhoff. I am a medical in the lab. My job involves the testing of the different samples that come from the patient in order to get to a diagnosis. Okay, so basically the doctors come to us with questions. They will know what the patient has, whether the patient has infection or tumor or some kind of autoimmune disorder, for example. So basically we do the testing according to what the doctor is suspecting in order to get to the diagnosis. The work is varied. There are samples that we get. It could be either blood, it could be bone marrow, it could be tissue, it could be organs, it could be body fluids, and we test accordingly to what the doctor is suspecting. And we look at the cells under the microscope. This is a normal peripheral blood cells. And in the microscope, we're seeing the red blood cells, the white blood cells, and the platelets. There are situations when we see abnormal conditions. This is a case of a leukemia, where we're seeing that the patient has a lot of these abnormal cells in the peripheral blood. So our job is to identify exactly which type of leukemia it is by performing intense and specialized tests on the sample of the patient in order to get to a diagnosis. We communicate the diagnosis to the doctor, and the doctor then eventually chooses what type of therapy the patient is given. Once the therapy starts, we also monitor that the patient is responding as expected to the therapy.
Like, I have a question. Being an expat who are really into the medical field and they wish to come here, so you have any suggestions for them, those who are looking forward to come to Malta and work, but especially in the medical field?
So basically, in order to be able to work in our field, you would require that you have a work permit here in Malta, and also to undergo the applied biomedical science course, which is a 4-year course in biomedical science in order to get the degree. And once you get the degree with the warrant, you can work as a biomedical.
And we can apply from the government websites, or there is some different way of applying?
No, it's through the website, yes.
Okay. Thank you so much for sharing. Thanks a lot. This section is for the medical lab scientists.
Here we have environmental health officers, then we have pediatric.
The emergency team, and they are showing some demo how the emergency team works during situations like this. This is for radiographers. This is medical physics. तो दोस्तों, आप लोगों ने देखा ही है, मैंने जितना हो सके लोगों से बातचीत भी करी है. अलग अलग स्टॉल्स में इन लोगों ने डिफरेंट सेक्टर्स, मेडिकल फील्ड्स के बारे में बताया गया, वेदर इट्स फार्मास्यूटिकल्स, वेदर इट्स न्यूरोलॉजी. मैं तो मेडिकल प्रोफेशनल नहीं हूँ, बट इन प्रोफेशनल्स से आज बात करी है. अंदर डॉक्टर्स, नर्सेज जितने भी थे, ना हमसे इन्फॉर्मेशन शेयर किया है, वो सब मैंने प्रेजेंट करने की कोशिश करी है. बाकी का जो इन्फॉर्मेशन है वो डिस्क्रिप्शंस में डाल दिया है, और अप्लाई कैसे करना है जॉब्स के लिए वो वेबसाइट्स और लिंक्स भी मैं शेयर कर रही हूँ नीचे. ऑल द बेस्ट. ऐसे ही वीडियोस के लिए, इन्फॉर्मेशंस के लिए मेरे चैनल के साथ बने रहिए, एंड कीप सेइंग एंड कीप वॉचिंग. ओ यस, टू लिमिटलेस, एंड डू नॉट फॉरगेट टू लाइक, शेयर एंड सब्सक्राइब. बाय.